Hello, my name is Brett Teplitz. I'm a PGY5 at UPMC in Pittsburgh, and today I will be presenting Are We Doing Enough? Trends in Pediatric Urology Fellow Case Volumes of Complex Reconstructive Surgery. Bladder exstrophy prevalence and the prevalence of many other rare congenital disorders are on the decline. A 2024 study analyzed data from 20 birth defect surveillance programs in 16 countries from 1974 to 2014. They found an overall prevalence of 2.58 per 100,000 total births over this time. They also noted a statistically significant decline in prevalence from 2000 to 2014, shown in the graph on the left. This trend is supported by EuroCat data, shown in the graph on the right, which includes 69 primarily European congenital anomaly surveillance registries. The overall prevalence here, combining bladder exstrophy and/or epispadias, was 6.6 per 100,000, also declining from 1980 to 2020. A 2013 study in the US, specifically, demonstrated declining BE prevalence from 1997 to 2009, which dropped from 2.4 to 1.6 per 100,000, despite increases in epispadias and stable ambiguous genitalia rates over the same time. Anecdotal reports among fellowship program directors indicates a perception that the case volume and experience of PEDS fellows is declining, with rare and complex procedures becoming more likely to be performed in a shrinking number of specializing academic centers. This creates a potentially concerning scenario where the pool of adequately trained surgeons for rare but severe disease processes may be vanishing, despite domestic and international needs. We aim to bridge the gap in the literature on prevalence data and fellowship case volume, in addition to providing novel insight into perceptions of fellows, recent grads, and fellowship directors on criteria for competence and proficiency, while demonstrating the gap between reality and perceived ideals to create adequately trained surgeons. This was a two-phase study. First, we performed a retrospective analysis of pediatric urology fellow case logs to trend the incidence of complex PEDS cases in the U.S. from 2010 to 2022. De-identified self-reported case logs were obtained from ACGME records for graduating fellows. Once we had these numbers, we wondered how people felt about their case volumes and whether they felt they were ready to practice independently. Was this enough? There's been no research done on the learning curve for BE cases because they are so rare and complex. As a surrogate for evaluating this in the absence of validated benchmarks, and to provide some context on the numbers we found, we distributed a cross-sectional survey of current and recently graduated PEDS fellows and program directors regarding their perceptions of adequate case volume of complex recon cases. The ACGME data revealed a mean of 2.86 total BE cases per graduating fellow from 2010 to 2022. There were no significant changes in case volumes over the course of this time period. The median number of cases was only 1.6. To put it another way, frequently, depending on the year, a graduating fellow that performed only one bladder exstrophy case over the course of their entire fellowship would be in the 50th percentile of graduating fellows, more than half of their peers. Yet some fellows completed over 15. This data may lie behind the decision to remove bladder exstrophy case minimums. Many fellows just weren't seeing enough. We achieved an overall response rate of 79%, with 75% of PDs and 83% of fellows completing it. The most fellows voted that 16 to 20 cases are necessary for proficiency in bladder exstrophy. Interestingly, this was the same number they gave for proficiency in robopyloplasties. Program directors, on the other hand, most commonly voted only 11 to 15 would be sufficient. We defined competency as the knowledge, skill, and judgment to successfully complete a task, but not yet demonstrating one can do this on their own. Proficiency occurs when a trainee can do this independently. Only 13% felt ready to perform these independently, and 21% intend to do so, which notably means some fellows aspire to perform a procedure that they admit themselves they aren't yet ready for. For reference, over 95% of fellows would feel comfortable doing a robopyloplasty independently, according to our survey. Given this is such a rare procedure performed in such a small subset of the peds urology community, we wondered if exposure and expertise in BE procedures was an expectation by both leadership and fellows themselves. Interestingly, 56% of fellows and 44% of PDs felt fellowship can or should provide enough exposure to complex recon cases to allow for proficiency. If this is a problem, how can we solve it? Fellows and PDs had some ideas. We highlighted several options, and there was concordance in the answers, with starting practice in a high-volume setting and apprenticeship models being the most popular. In conclusion, case volumes of bladder exstrophy remain low, yet stable over the past 12 years, with significant variation between fellows. The majority of fellows fall far short of the volumes they and their PDs feel would be necessary for competence and proficiency. Furthermore, there exists a disparity between trainees and program directors in whether a goal of fellowship is to sufficiently prepare fellows to perform these procedures by the time they graduate. So, regarding the current training model and climate, is this enough? This study reveals we are only training a few fellows to be competent and proficient to perform these independently without significant additional training, but the case burden is low. But what if prevalence rises? What are ethical and feasible ways to bridge the gap, and at what cost? These are questions the pediatric urology community collectively should consider. Thank you very much.